Good afternoon, everyone. How
Good
are you
afternoon.
today this Thursday afternoon? And good afternoon to our speakers as well. I hope you're all well. Maybe some of you will have a little ache here, a little pain there, and that's why you're here for our Managing Neck and Back Pain at Home webinar. Maybe even better, some of you may want to prevent all of these things. That's why you're here. You're in the right place. So unfortunately, we have come to a time where we have to rely on these kind of resources, where there are no public talks out there, consultations to doctors, to physiotherapists, and other healthcare professionals have been reduced. So many of us are wondering where we can get the help that we need sometimes. And so Masa University has come with a series of webinars from our various faculties for the benefit of all of you. The School of Physiotherapy recognizes the current needs where a lot of us are working from home, and even when you go back to your work, you're still at the desk, the computer or the laptop. And thus the birth of our first seminar, Managing and Preventing Neck and Back Pain. We have gathered speakers who are experienced in this area, and they have so cordially agreed to speak for us, so we have to thank them for that. Now, before I introduce the speakers, let me first go through a few house rules. First, let me ask you to like and share the Masa University Facebook page, because if you do this, you'll be alerted of the next webinars that we have, and we have webinars from all the faculties. Now, at the end of this webinar, we have a little reward for you. There will be a quiz and a survey. Very quickly, you can do it, and you'll get an e-cert for it. So please fill it up. Don't worry about taking notes because this recording will be on for about another 48 hours. Okay, so once you fill it up, please send it to us. And I'm so sorry I can't present you the certificate myself. I'll just have to send it to you. Now, each speaker has a topic that he or she will be covering, and at the end of all of this, we have a panel discussion where you can ask all the questions and we can discuss the answers and give you the right direction to go to. So without much further ado, let me introduce you to our esteemed speakers. Firstly, I have Dr. Muralidharan Perumal. He's consultant pain management at Tengku Ampuan Rahimah Hospital, Klang. So maybe Dr. Murali, you can give us a quick wave. Yes,
That's
there
me.
is.
Where is it? Okay.
Now, Dr. Murali attained a fellowship in pain management in 2007 from Singapore, and is also a fellow of interventional pain practice from the World Institute of Pain. In addition, he has also attained completion of subspecialty training in anesthesia and intensive care from the Ministry of Health. The pain management clinic in Hospital Tengku Ampuan Rahimah was established in 2008 and has been managing more than 1,000 patients. So if we have to talk about pain, most definitely Dr. Murali is one of the best experts we can find. Thank you for being with us, sir. Next, we go to Miss Jacinta Lim, a little way from Miss Lim. There we go. Now, she is our very own alumni, having graduated here with a diploma in physiotherapy in 2008. She started her experience working as a physiotherapist in Singapore, and while she was there, she completed her degree conversion. Ms. Lin later went on to pursue her dream and obtain a master's in physiotherapy from Curtin University, Australia. She has several other specialized qualifications in physiotherapy, being a vestibular rehab therapist, a certified postdoc clinical Pilates instructor, as well as a pre- and postnatal certified instructor. Now, after Singapore, that led her in the direction of the musculoskeletal, sports, and chronic pain management areas. So she went back to Kuching, and Kuching is very lucky to have her set up rehab concept together with a dedicated team. Currently, they are working on changing the Sarawakians' perception towards physiotherapy, and I'm sure since she has started, she has very well done that. And last but not least, our third speaker, Dr. Mahendran Jayaraman, is our very own lecturer in the School of Physiotherapy. And away from Dr. Mahendran, please.
Hello.
Yeah. Now, he is a bachelor in physiotherapy under the Dr. MGR Medical University from India in 2004. In 2006, he was awarded the Masters in Physiotherapy. In 2014, he received his doctorate in physiotherapy from the Bundelkhand University, Uttar Pradesh. Now, in addition to clinical experience, he has more than 12 years of academic experience both in India and Malaysia. He has published in both national and international journals and has conducted numerous workshops and seminars. His specialty, of course, is in the musculoskeletal area, specializing in manual techniques and pain management. So here too, we have the right man in the right place. Okay, right now we can be well on our way with our speakers covering topics such as good posture, acute and chronic pain, neck pain, and back pain. Learn about the cause of it, the prevention, and some management as well. So, shall we begin? Let's start with Dr. Mahindran. Dr. Mahindran, please let me first pull up your slides. So, Dr. Mahindran, please start
Yeah.
as you wish.
Thank you, Natamura. Good afternoon, everyone. I think you're all being very safe in your home. So today we will take a topic on posture.
Take one.
Okay, so first we will look at some basic information about posture and what are the indications and how to treat those posture problems in time. Okay, so what is posture first? Posture is nothing but any position if you are adapting, all are termed as posture. Okay, so let's see the definition first. Posture is a position or attitude of the body, a relative arrangement of the part of a specific activity or a characteristic manner of bearing the body. Okay, this is what definition is. Next slide, please. Okay, let's see what is the term for good posture. Any posture, it may be a supportive posture like sitting on a chair, or unsupportive posture like standing independently. If it requires very minimum effort or least strain, those postures are termed as good posture. Okay, any posture, either it may be a non-supportive posture or supportive posture. If it requires minimal muscle effort or least strain, those posture are termed as good posture. Okay, next slide. Okay, there is an acronym for posture. The first letter P stands for pelvis. Okay, pelvis is the bone which is located at the down part of our body. We should be at neutral position. O stands for on a whole foot. When you try to stand, you should use both hands in a whole position. Next, S stands for stable joint. T stands for tight abdominals. U stands for upright ribs. R stands for retracted shoulders. And finally, the E stands for ear over shoulder. The line between the ear and the shoulder should be in equal. Okay, next slide. What are the main characters of good posture? Okay, what are the main qualities? The first quality, the posture should be good in erect position or in upright position, which needs or which requires less energy. Those posture is termed as good posture. And also the line of gravity. What is the meaning of line of gravity? Line of gravity is an imaginary line that dissects the body either into left or right or front or back. That is known as line of gravity. If the line of gravity is located at the base of support, at the center of base of support, so that posture is qualified as good posture. Okay, next slide. Okay, there are three types of posture. Either if you are in sitting or in standing, there are three types of posture you can be able to analyze it. The first type of posture is called as fatigue posture or lazy posture. So as with the name, this posture requires very less energy to maintain it. Next posture is called as easy posture. It needs some optimum energy to maintain it. The last one is called as rigid posture or contracted posture. This posture needs bit more of energy when compared with easy posture. So let's we see in detail about it. Next slide. What is the quality of easy posture? Easy posture, the body alignment is symmetrical. Symmetrical means both sides of the body in a proper line. And when you are maintaining the easy posture, we cannot able to maintain for longer period of time. Okay, so we can able to maintain for certain period of time. Afterwards, we have to change the position. Okay, next slide. Fatigue posture, as with the name, this requires very less energy when you are comparing with easy posture. Lesser than 10% of energy is needed to maintain this posture. And as with the name, this posture can be maintained for longer period of time when you are comparing with easy posture. And another quality of fatigue posture, it is an asymmetrical posture. Asymmetrical means the body alignment is irregular. If any posture is in these qualities, this posture is termed as fatigue posture. Next slide. Next slide. The last one is known as rigid posture. It also known as posture of attention. So, as with the name, this posture requires excessive energy. When compared with easy posture, it needs nearly 20 percentage more than, okay, the energy wise, it needs 20 percentage more than the easy posture. And also, okay, it needs, we cannot be maintain this posture for a longer period of time. Okay, next slide. Next slide, please. Okay, let's come to the poor posture. What is the meaning of poor posture? Any posture, if it is not in a proper alignment, if it is deviated from the erect posture, those are termed as poor posture. Any posture, if it is deviated, if it is irregular, okay, those are termed as poor posture. Next slide. So let's we see some overview of spine. A spine is a structure, this chain-like a structure, which is located at the posterior, that means the back part of our body. Okay, there are 5 important sections are there. At the top section is called as cervical, it also known as neck. The second part is thoracic, it also known as chest area. The next part is the lumbar. Lumbar is also known as back. The next part is called as sacrum. The last tail-like structure is called as coccyx. These 5 are the sections which are present in the spine. So if you look at the cervical and the lumbar, it projected towards forward, isn't it? So these curvatures are called as lordotic type of curvatures. Same way, if you look at the thoracic and the sacrum, these two curvatures are projecting towards backward. So these two curvatures are called as kyphotic curvatures. Okay, and then the last one is called as coccyx, or it is mimicking like tail. Okay, next slide. Next slide, please. Okay, let's come to the spinal musculatures. Okay, the muscle is the structure. Okay, The main function of muscle is what? Muscle is to maintain the spine in a proper alignment. That is the important function of the muscles. So there are two types of muscles which are located around the spine. The first part is known as core muscles. Okay, what is the meaning of core muscles? These muscles are located, okay, at all the sides of the spine. Okay, some are located at the right side and the left side. Some are located at front. Some are located at back. Okay, collectively these muscles are called as core muscles. The important function of this core muscle is to maintain the proper alignment of the spine, and also it used to give some mobility to the spine. These are the important functions of core muscles. Okay. Next is the regional muscles. These muscles are located as region wise. The muscles, okay, region wise. Some muscles are located at the hand area. Some muscles are located at the pelvis area. Some muscles are located at the abdominal area. So collectively, these muscles are called as regional muscle. So the regional muscles also have some influence on spinal mobility. Okay. So next slide, please. Next slide. So finally, we will some basic movements which are occurring in the spine. First movement is called as flexion. Flexion is also known as a forward movement. If you are bending the body towards anterior or forward, that movement is called as flexion. Then if you are trying to move your body towards back, so that is called as extension. So if you are moving the body either way towards right or left, so that is called as side flexion. Then if you are trying to move your body either towards right or left in the way of rotation, so that movement is known as rotation. So this is what spinal movements are. Okay. So that's it about some basic information about spine and posture. I think you got some basic ideas about that. Thank you. We will meet in next slide.
Thank you, Dr. Mahin. Okay, so now we've learned a little bit about our muscles, as well as some of our postures. Uh, if there are any questions, you can just type in your questions. We'll see whether we can answer it now or later at the discussion. So there was a question that somebody was asking. They were asking whether students can get the certificate or can everybody get the certificate. Please, everyone can get the cert. Just listen to our webinar, and at the end of it, answer the quiz, and you're eligible for the cert. Okay, next we have Dr. Murali. Dr. Murali, are you ready?
I'm here. Can you hear me? Can you hear me? Ma?
I'll start sharing the screen. So we'll go to the slides. Just give me 1 second.
Can you hear me?
Yes.
Otherwise, if we find that something is not proper, then immediate attendance by a physician, a doctor, is very, very important. Okay, so going back to our topic, yeah, managing acute pain and chronic pain. So we need to understand what acute pain means. So actually, acute pain means an ongoing pain that you constantly feel in the past 3 months. Okay, and it must have a reason for it, probably an injury, accident, okay, or disease causing this pain. But over time, that the severity of the pain must improve. Otherwise, then it has to be investigated. But in chronic pain state, it's different. What happens is the injury or disease has healed. Unfortunately, despite healing, you may still have persistent pain. And it becomes a problem because wound has healed, but you're still having or feeling the pain. So it may confuse you where is the source despite being healed. So this is where you need to discuss with the pain specialist regarding what are the possibilities or reasons for the continuous pain. Yeah, and cancer pain is also considered a chronic pain. Next. Okay, so what are the causes for neck and back pain? There are basically two areas where the source could be. One is myofascial. It's considered myofascial. Basically, it's from majority, big bulk of them is from the muscle. And then misalignment of the spine bone. And when there is a misalignment of spine bone, it causes changes in the surrounding tissues, especially the muscles. Okay, it has a reflex contracture to protect the spine bone that is misaligned. But if over time, if this muscle is not stretched or relaxed, then it could be the source of pain. And besides that, also you may feel pain which are localized, okay, at that particular spot, or it could be radiating. Radiating means shooting pain, okay, going down along the pathway of a particular nerve, okay, can feel numbness. Sometimes you feel burning sensation. Tingling too can be a problem. Somebody has said that kesemutan, like ants crawling over the arm, the foot, and all this. So the areas usually that is affected are the neck, arm, back, buttocks, even to the leg. And these are all disturbing points that we need to look into how we can overcome this pain. Next. Okay, coming to this myofascial pain. The one thing that not commonly identified, okay, by orthopedicians mainly, okay, is these trigger points. Trigger points are actually, I'll put it, a very nasty kind of point. It's very difficult to identify. It is there under the skin, deep-seated, and it could be very tender, tough, and if you do a deep palpation, okay, your partner might be massaging your shoulder or back, okay, and they may say something is tight here, okay, and you may shout in pain, that's very painful, okay. That could be the trigger point. And this trigger point can be very localized, but sometimes, okay, the pain from the trigger point is referred elsewhere. So what happens is this source of the pain is not identified because it's elsewhere, and you're feeling the pain far away from the trigger point. And the worst thing is, there were instances, patients that I see do feel that there are electrifying kind of pain, which they thought it is due to the nerve, but on further examination, it's actually a trigger point. So it can be confusing here, managing trigger points. Next. Okay, coming to misalignment. Misalignment means the alignment of the spine bone is not in its place. And there are various causes. And majority are trauma and accident, which commonly happens in our country. And when there is trauma and accident, okay, two major pathologies that happens. One is displacement of the spine bone. It runs away from its normal alignment. Another one is cracks or fractures within the spine bone itself. So what happens is the person who had trauma will have dull, diffuse, achy pain at the traumatized or trauma site, okay, and sometimes it can be electrifying. Electrifying is because the displacement of the spine bone may be impinging of the nerve at the spine. So then you feel some radiating pain shooting down, okay, over the arm or back to the leg. And if it's a recent trauma, the pain can be very, very severe. Next. Okay, the other one that is very common is disc diseases. That means pain arising from the disease in the disc. And to understand, this disc is actually a spongy material between the spine bones. It's actually a cushion to absorb shock within the spine bone for all the activities that we do day in, day out. Okay, but over time, sometimes it just dries out or loses the sponginess because drying, no water in the space, or even there's no nutrient supplied to the disc that it so the disc dies or dries or degenerates in the within over a period of time. Sometimes it's because of tear, okay, trauma, whiplash, trauma, or neck posture. Neck posture, basically, right now, what we have is this, what do you call, handphone problem. Okay, everybody bending their neck forward, so the weight of the head, okay, is not within the spine, but rather the gravity is away from the spine, and this can chronically cause this disease and pain. And usually, again, it will be dull, achy pain, more localized, okay, can be diffused around the disease disc. Sometimes it's again electrifying if it's impinging the nerves due to the disc bulge. Next. Okay, osteoarthritic disease. Now, this is mainly due to worn off or worn down of the cartilage between joints in the spine bones. Okay, it can be at the neck, it can be at the lumbar spine. It's a bit rare at the thoracic side. This could be more of what you call infection, okay, inflammation within the joints, chronically inflamed, and then it just becomes osteoarthritic. Or sometimes it's because compression due to the disc bulge, reduce of the disc height. So the facet joints compresses also causes arthritic kind of a disease, and the pain usually it's localized or it's referred to a wider area, but again it's always achy pain. It's not radiating. Next. Okay, spinal stenosis. Now this means actually narrowing of the spinal canal. So it usually happens in the elderly, or if in the past there is spine surgery or trauma. The kind of pain complaint presented by patients are always very complex. It's very difficult to identify because, as you see, if you look at the picture, okay, the sources can be from various sites. There are ligaments, hardened ligaments. Okay, the nerve is entrapped. Probably the disc bulge here, there's a disc bulge there compressing on the nerve. Also, arthritic changes at the facet joint. So all this can be a mixture. And there's a mixture, so it's very difficult to identify what's the actual cause. But generally, if an MRI is done to the spine, MRI spine is done, we can identify that it's actually a narrowing of the spinal canal. Next. Okay, please do understand this. When you have pain, okay, there are two statements that I always emphasize, that actually one source or cause with multiple sites of pain, or the other possibility is multiple source or cause for one site of pain. So it's very complex to identify the actual source of pain. So the physicians usually have to have out of the box thinking, where could the source be? As I told you, like trigger point. Trigger point may not be identified, but the patient may complain of pain at the back. So we really have to look for the trigger points. If is it truly a trigger point, or is it some facet joint pain, okay, or severe myocontracture, okay, a reflex contracture of the muscle due to some pathology of the spine. Okay, so it's complex, but with pain physicians, I suppose we can identify the multiple sources and advise you, okay, where could the source of the pain be. Next. Okay, what happens if pain is not effectively or optimally managed over time? See, in acute state, acute state, okay, as I said, the pain, severity of the pain will be lesser over time as the injury heals. But there is a state where in chronicity, a state of chronicity, chronic pain, you may go through a condition whereby, okay, it affects you biologically, psychologically, and socially. Biologically, yeah, the physical health, okay, becomes weaker. You may not be doing exercises as much as you wish to do, okay, and then feel a lot of pain. Probably you may complain of gastritis, because of the stress, and taking a lot of medications, okay, all this triggering the gastritis, and then psychologically, in acute state, you may have a lot of anxiety, but over time, it just insidiously changes into depression. You may not realize, but you might be in a depressive mode. And in a depressive mode, well, your conduct changes. Invariably, your conduct changes, and this affects how you socialize with people. Okay, your friends, your relatives, your wife, your husband, everybody. They may how they react and how they respond to you, how you react and how you respond. Okay, it all can be a big problem within your social circle. Okay, so what we hope is you truly take care of this pain and balance the biology, psychological, and social impact of the pain. Next. Next. Okay. Now, see, this is something that you must understand. Not all pain are safe. Okay. There are certain pain that should trigger you that you must get the immediate attention of a doctor, or you have to go to a hospital. Okay. Especially when there is trauma. Okay. And if there are back pains lasting for a prolonged period, and you find that whatever you do, whatever medications you take or exercises you do does not make you feel any better, sometimes there is a change of your bowel habit or your urinary retention, okay, or uncontrolled urine. So this has to trigger that you have to seek doctor's attention. Now the other one is fever. Fever means there is a source of infection. There's possibility. Sometimes it could be infection in the disc, ascites, or even TB ascites. So all this has to be investigated whether you have to be treated with medication, oral medications for the TB. Okay. So always remember these are red flags. Okay, red flags that you must seek immediate attention from a hospital. Then there's another one that is called the yellow flag. Yellow flag is something that we don't want you to have because it's an attitude. It's an attitude on the patient. Okay, how becoming how when you are passive, okay, not taking any proactive initiative to be well. Okay, when you're passive and having this attitude that you will get better by not doing active, proactive exercises, will impede your healing process of the pain. So one of them is beliefs, believing that lower back pain is harmful or disabling, especially in chronic state, okay, chronic state, and then fearing and avoiding activity due to back pain, tendency towards low mood and isolation, or having a strong expectation that passive rather than active treatment will help. Now, all these sorts of negative thinkings will not help you to feel better in terms of managing your pain. So we need to change this attitude. Okay, sometimes we do refer to psychologists. Okay, psychologists to help you to change your mood and how you respond towards pain management. Next. Okay, finally, now how do you wish to manage your pain at home? Okay, so I would suggest that, well, you have a lot of forgive and forget with your family and friends. Okay, so that you get a lot of understanding and support from them. So this will help you to allay anxiety or depression. Okay, you have a good social life. Okay, be happy. Yeah, definitely it will help you. Okay, and how about a home? Make sure it's warm. Okay, not very cold and uncomfortable to you. warm enough, and good ventilation, like so that you have a nice, good lighting, okay, to help you to relax at home. Now, the other thing is, make sure you're comfortable sitting or sleeping. Okay, you may choose to have pillow or back supports or neck supports. Okay, to help you to reduce the pain. Okay, during your sitting or sleeping period. But remember, in the long run, you must plan to wean off using these pillows or back supports, because um, we don't want you to be dependent on them. So that is why this physiotherapy, home physiotherapy exercises that helps to strengthen muscles, okay, must continuously be done at home. Okay, this is especially for the chronic pain, okay, not for acute pain. In acute pain, more rest is required, okay, because the wound actually will heal. But in chronic pain, the wound will not, there's no wound to heal, okay, but you have to work on your muscle strength, and also improve your posture and try to manage the misalignment, as I've already mentioned in the previous slides. Okay. The other thing that we sometimes offer, and if it's possible, is doing Tai Chi and having massages. Okay, massage does help, but it's all short-term effect. Okay, Tai Chi may be a longer-term effect, but you have to be able to do it comfortably. Don't over stress yourself. Make sure your body is warm. Don't do any physiotherapy in a cold environment, or your body is still very cold. You're feeling very cold. Okay, and all these exercises must be tolerable. Now, the other one that you should be able to do or should be doing is breathing exercises or prayers. Okay, prayers are very, very strong analgesics to the brain. Okay, prayers, because it distracts you from focusing you to the pain sites. Okay, also doing activities such as reading, okay, or even if you want to sing along, okay, reading or listening to music, and doing a lot of mind body relaxation, meditation if possible. Okay, so these are all for you to focus away from pain. And if you're on medication, okay, if you're on medication, please do understand all the prescribed drugs from the doctors, because you see, many a time I do find, okay, you are under what do you call under knowledgeable about these drugs that are prescribed. Okay, so you need to be always aware, okay, what you are being prescribed. Okay, do report if the medication is ineffective. Intolerable means like you have side effects, gastritis, or too drowsy to the medication. Okay, or even allergic to the medication. And finally, always be conscious and avoid any accidents at home, such as slip and falling, because this do happen. Okay, when you do things subconsciously or unconsciously, just um, uh, react to a situation, slip and fall, and all your back pain, whatever effort you have done or taken all this while, will go to waste, because you'll be back to the square one with an acute pain. Okay, so with that, I think that's the end of my presentation, and thank you.
Thank you, Dr. Murali. Let me just get to our screen. Okay. Some of you would have seen that trigger point slide with all the red dots, and I'm quite sure that's quite a popular feeling, isn't it? Suddenly you feel one red dot, you feel you can stab it with something. Quite a common feeling, that trigger point. And I'm sure some of you will have some questions about that later on. So we've got some questions here now. We will discuss it at the panel later. But I also like to tell all our viewers, thank all our viewers. We've got about 304 viewers right now. So thank you very much for tuning in. Keep the questions coming. And also at the end of it, please let us know what else you want to hear about in our future webinars. We've got some topics coming up like osteoarthritis and exercises, as well as shoulder pain. Okay, Dr. Murali, just stay with us. We'll go to the panel later on. So right now we'll go to our next speaker. Dr. Mahin is coming back, and he's going to tell you about neck pain, the causes of it, and the prevention of some neck pain. Let me again share screen with you. So, Dr. Mahendran, are you ready?
Yeah, I'm ready.
Okay, let me just go to your. Okay, Dr. Mahin, please start.
Yeah. So once again, hi all. So now we're going to discuss some basic information about neck pain, what are the reasons for neck pain and how to prevent it, some home-based remedies to control the neck pain. So those basic informations we're going to discuss now. Next slide please. Here if you look at this area is called as cervical or neck region. So it has some important responsibilities. Number one, it has to bear the entire weight of the head. That is the main responsibility of the cervical area. And it has less holding support when you compare with other areas, especially if you are taking trunk or hands. That's supported with the main trunk, but if you look at the cervical area, it is hanging freely without or very less support. And also it has some more responsibilities. The nerves, the spinal nerves, which are running along the cervical area, which has to guard it, and some important blood vessels. Okay, it also run along the pathway of cervical. So it has so much responsibility with less control or less stability provided by the muscle. Okay, next slide please. What are the main causes for neck pain? Okay, the main cause is overuse. Whatever thing, if you are using excessively, so that will arise some pain in the neck region, especially if you are hunched with a computer or if you are using smartphone for a longer period of time, so that will trigger the muscle strain. Or certain minor things like reading a book in bed or gritting your teeth or these positions or these activities also induce some strain in the neck area. The next one, poor sleeping habits, as doctor mentioned earlier, poor sleeping habits without a proper support from pillows or improper positioning. Okay, these also will induce the neck pain. The last one is psychological stress. If you are having any worries or if you are having any strains, emotional strains, so that also will trigger the neck pain. Okay, next slide please. What are the common symptoms? Okay, if you have any problem in your neck or neck syndromes, what are the common symptoms it will shows? First thing, you will be feeling neck pain in the nature of dull aching. Okay, the pain, the type of pain, it is known as dull aching pain. Sometimes the pain will be aggravated or worsened when you are trying to do some movements. Either if you are doing some power movement or rotation movement, the pain will get worsened. Okay, this is the first symptom. Second symptom, you may feel some tightness or stiffness around the area of neck, especially at the back of the neck, okay, or at the bottom of the neck. Here you can feel some tightness, okay. Next, sometimes the tightness may be extended to your upper back, okay, it may extend to your upper back, or sometimes you may feel the pain at your shoulders. This may happen. If the symptoms are exceeded, you may have a chance to get the pain at these areas also. Okay. Sometimes, if you have any severe symptom, the pain will be lost for 6 weeks. So you should not wait until that. You have to consult your doctor or physiotherapist. But sometimes, if you are ignoring that you are having pain, so it may have a chance to extend until the period of 6 weeks. Okay, next slide, please. Some other symptoms, okay, some other symptoms which is come along the neck pain. First is numbness. Okay, numbness is like no sensation, no feeling, nothing. Okay, in certain areas. Sometimes you may have tingling kind of sensation. Sometimes you may have some tenderness. Sometimes you may have a sharp shooting pain. Sometimes you may have less range of motion, especially in the neck and in the shoulder regions. Sometimes you may have pulsation around the neck. So if you have these symptoms, these are all some danger signs. So it shows that some structural involvement is there. So you have to consult your doctor or the physiotherapist. Okay, next slide. How to prevent? If you are having neck pain, so how to prevent it? Number one, we have to maintain a proper posture. That is very, very important. You have to maintain a good posture. Second one, take a frequent breaks. Whatever activity you are doing, whether you are working with computer or you are writing or cooking, whatever activity you are doing, so take a short while of break. So that will give some relax or that will give some effect to the neck pain. Adjust your desk. If you are writing on the desk or if you are doing some computer activities, adjust your desk in an optimal position or adjust your computer in an optimal position. Adjust your keyboard in optimal position. So that will help to reduce the pain in the neck region. Avoid tucking the phone between the ear and the shoulder. Most of the youngsters are doing this kind of activity. They are trying to keep the phone between the ear and the shoulder. So that will induce some strain. So avoid such kind of activities. Then quit smoking. So if you are a smoker, so what the thing you have to do is you have to stop smoking. Okay, some studies are saying if you are a smoker, you have a chance to get some neck pain. Okay, so next one, avoid carrying heavy bags with straps on your shoulder. Okay, the next one, sleep in a good position. What is the meaning of good position? Next slide. Next slide, please. So if you look at in this position, either if you are sleeping on your back or either you are sleeping on your slide, what the thing you have to notice the alignment of the head, neck and the shoulder should be in a proper line. Same way if you are lying on a side, okay, the alignment of the neck, head and the trunk should be in an equal line. If the line is going towards forward or backward, the neck will be get straight. Same way for side lying, if your pillow support is not in a proper way, either if it is higher or lower, so that will induce a strain or pain in the neck. Okay, next slide, please. So, what are the tips I can give it while you are maintaining good posture while sleeping? Use a feather pillows. Okay, soft pillows. If you are using the soft pillows, so that will support your neck in a good way. Okay, so though it is a feather pillow, you will not use for longer period of time. At least for every year you have to change it. Why? Because the structure of the foam will be collapsed. Okay, so if you are getting some pain during sleeping, then immediately what you have to do is you have to change your pillows. Avoid using too high or stiff pillows. Sometimes if the height of the pillow is too high, so that will give some strain to your neck. So if you wake up in the morning, you feel some stiffness or pain in your neck. So don't use high or the stiff pillows while you are sleeping. If you sleep on your side, so when you are trying to sleep on your side, what the point you have to know is the height of the pillow at the neck area should be higher than the height of the pillow at the head area. Okay, so if you are maintaining this way of keeping the pillow, you can avoid the chance of neck pain. Okay, next slide, please. So if you are having pain, neck pain, okay, how to give some home remedies for that? Okay, so first method is known as towel massage. For that, what you have to do, you have to take a soft towel, so wind around like this. Okay, so one should be at the top on your forehead, one should be around the neck. What you have to do it, you have to pull, okay, in both way, okay, simultaneously. So this method will help to give some pressure over the neck muscles. So if you are having any tightness in your neck muscle, so by doing like this, you can get some relief by that. Okay, next slide. Next slide. Okay, back on your neck. Okay, so what you have to do for this, you have to take your three fingers, keep it on the side which is behind to the ear. Here you have to place it and press it slightly, and you have to rotate it either clockwise or anti-clockwise. So by doing like this, if you have any pain in this area, so the blood supply will be increased and it will reduce the tension in that area. Next slide. So side muscle squeezing. Okay, so for that, what you have to do it, you have to take your palms, okay, keep it on the anterior, that means the front of your neck. Okay, the other fingers should support at the back side of your neck. Gently you have to squeeze it. Okay, start from the bottom of the neck and you have to move on. Again, you have to come back. So likewise, you have to squeeze it. Don't apply too much of pressure. So that will induce more pain. So give the squeezing very gently. Okay, next slide. There's some exercises. First exercise is called neck glide. So how to do this exercise? Okay, first you have to start your neck in a neutral position. Then you have to glide forward. Okay, like this. Okay, hold in this position for 5 seconds. Then again you have to come back. Again you have to go backward. Okay, hold it for 5 seconds. Come back to neutral. So likewise you have to repeat for 10 times. Okay, next exercise. Next slide, please. Okay, flexion extension exercise. Okay, so how to do this exercise? What you have to do? First, you have to keep your neck in neutral position. Okay, move your neck forward until the maximum range you can reach it. Hold it for 5 seconds. Again, you have to come back and you have to move your neck backwards and hold it for 5 seconds. So likewise, you have to repeat for 10 times. Okay, next exercise. Next slide, please. Same way for side bending, how you have to do it, start from the neutral position. Okay, move your neck towards your shoulders, either towards right side or left side. Hold it for 5 seconds and then you have to come back. Same way you have to repeat for opposite side. Next. Rotation, okay, so again you have to start from the neutral position. Okay, move either towards right or left. Hold it for 5 seconds. Again do the same for opposite side. Okay, likewise, you have to repeat for again 10 times or more than that. Next slide, please. Like some strengthening exercises. So first exercise is called it as isometric extension exercise. How to do this? So how first you have to keep your neck in a neutral position. Okay, keep your hands, clasped hand on the back side of your head. So try to move your head towards back at the same time your hand should be resisted. Okay, hold it for 10 seconds or 20 seconds, release it. So likewise you can repeat it for 10 or more number of times. Okay, next slide please. So isometric side bending exercise, how to do it? Start from the neutral position, place your hand at either right side or the left side of your head. Try to move your head towards the same side of your hand. At the same time your hand should resist that. Okay, hold it for 5 seconds and release it. Okay, next slide. Okay, isometric neck rotation exercise, how to do it? Okay, first you have to place your hand either side of the chin or cheek. So try to rotate your head either to the same side of your hand. Okay, hold it for 5 seconds. At the same time your hand has to resist that. Hold it for 5 seconds and release it. Likewise you can repeat for 10 times. Okay, Next slide. So the exercise which we already shown to you, you can able to do when you are doing any continuous activity like watching computers or whatever activity you are doing, you can able to do this exercise for every 30 minutes or 20 minutes if you are able to do. Okay, next. So when you can consult your doctor or physiotherapist if the symptom is more severe. Okay, if you are having uncontrolled pain, okay, then you have to see your doctor. And if the symptoms are persist for longer period of time without any relief, then you have to consult your doctor or specialist or the physiotherapist. Or sometimes the pain may be aggravated, okay, towards your arms or leg. So that is the main indication to consult your doctor. Sometimes the pain may be associated with headache, numbness or weakness or tingling. If you have any of these symptoms, then that indicates that you have to consult your doctor or physiotherapist. I think these exercises may helpful to reduce your pain. Thank you.
Oh, started already. Sorry, I was massaging my neck following Dr. Mahin's very good advice there. I'm sure all of you were doing something or the other. So as there's a few questions coming up as well, so we will be discussing that later. And also our viewers have been increasing, so thank you very much for that. So thank you, Dr. Mahin. We'll meet up with you again in a bit. Now we invite our next speaker, Miss Jacinta Lim. She's just being turned on. Hi, Miss Lim. How are you?
Hello, hi, Good, good. I'm good.
So we're saving the rose for the last, okay? So let me share her screen. Okay, Jacinta, you're off.
All right. Good afternoon, everyone. Thank you for staying tuned and join us here today. Being the last speaker of today's sessions, I'm going to talk about back pain, what you need to know. Right. In general, back pain is a very broad term. So what I'm going to cover here, it covers all the back pain from the thorax regions to the lumbar, your lower back region, as a general. And there are a few topics we'll be discussing about in the next slide. All right. So topics. Can we go back one slide? So topics to be covered will be why do you get back pain, the contributing factors, and what are the types of back pain, what are the possible structure involved, and should you be concerned. Last but not least, we are going to also talk about the concept of back pain management. Now let's go to the part one first. Why do you get back pain? Right. So if you have been with us since the beginning of this talk, you would have noticed that in Dr. Mahendran talk and also Dr. Murali talk, various factors had been mentioned. Particularly in Dr. Mahendran talk, you understand that posture is actually one of the main contributing factors to many musculoskeletal problems. Right? Well, in the modern lifestyle, unfortunately, we are very gadget dependent. Most of us, but regardless of what profession you are in, most of us are very much depending on laptop computer. And a prolonged static posture in a desk in a workstation poorly set up lead to musculoskeletal problem, which lead to the back pain. And in the other picture, you can also see all of which even I myself am very guilty of. The forward head posture when we use handphone. Unknowingly, we progress into that posture because of habits or just a subconscious movement. Now you can see the more forward head posture you have, it exerts more strength in the neck as well as the upper back. And sometimes the body compensates, you might even get mid back pain from this, right? And let's look at the next slide. So the other factors we have, the other factors that contribute to back pain will be trauma. And we have seen all this in Dr. Murali's talk as well. Falls contribute to it. A more severe form of trauma, like what we have in the accident. So in the accident, we normally get much severe trauma than a simple fall because it involves multiple sites, much more impactful than just a simple fall. Therefore, more injuries to your joint, your soft tissue. Spine fracture. Spine fracture can happen from trauma, from both fall and accident. It can also happen without a trauma. For example, in people who have osteoporosis, which is a condition where the bones soften due to the loss of bone mass. A very common, it is very common in ladies, women postmenopausal. As a physiotherapy, this is something that we'll pay particular attention to when we see people of certain age group or certain population who come to us with certain medical history. So this is one particular important thing to screen for when we see someone with back pain. And look at the next slide. Other contributing factors are like excessive weight. So excessive weight gain, it exerts more pressure to your joint. Therefore, the surrounding tissue around it will be affected as well. And occupations. Certain occupations predispose us to more neck, back, or other joint pain problem. I'll give you an example. For example, people in construction line, a lot of hard work for the blue collars worker where lifting, carrying, and repetitive hammering, hackings are required on day-to-day basis. This will accelerate the wear and tear of the bones, joints, soft tissue like your muscles as well. Sedentary lifestyle, and this is a commonly known fact that the more active you are, the healthier you are. And on the contrary, if you are not very active, fitness level reduces, muscle get weaker, and it doesn't favor your whole body condition in general. Weaker muscles, stiffness in the joint predispose you to back pain as well. And we look at the next slide. Pregnancy. Very big change in hormone level during pregnancy, especially throughout the second to the third trimester. Expected moms tend to complain of back pain. This is because the hormonal changes, it creates some changes to our body as well. Your muscles become more relaxed, ligament as well, to accommodate to the development of the fetus. At the same time, it does affect our back because of the weight of the fetus. That will contribute to back pain. And old age, aging, wear out our joints. Genetic, which is a less commonly known fact. There are many studies out there supporting how genetic affect people in the family, and even twin study. So people who tend to have OA running in the family, who have back pain running in the family, seems to have been proven by all these studies. And next slide. All right. Before I talk about the type of back pain, there's also one not very commonly known factor which had been mentioned earlier in Dr. Murali's slide. The psychological factor, the psychosocial factor, we term it. It has become a new norm for us to live under high stress, and indirectly that become a contributing factor to some of the body ache, pain. Some people even go into chronic pain because of this factor, but we will not discuss it in our sessions here because it will take quite a great deal of time to dissect into that part. Now let's get back to this slide. What are the types of back pain? Well, if you look up online, you'll see a lot of classification out there. Coming from a physiotherapist's point of view, we will always first classify back pain according to time frame. So if you have anything that come on suddenly and it lasts you about plus minus 6 weeks, that will be categorized under acute. And the chronic, it lasted more than 3 months with some residual pain here and there. And some people have it flare up again in between. So this is considered as chronic pain. Anything that come in between these two can be considered as subacute, or in some countries, some practices, it is still seen or classified as acute. What I would advise all of the viewers, it will be very much the same like what Dr. Murali spoke to you just now. Seek early treatment in order to prevent yourself from moving into the chronic phase, which is a much more troublesome phase to tackle, right? And let's look at the next page. Now, if we are going to classify the back pain by nature, we'll classify it by mechanical or non-mechanical. So mechanical got to do with movement or any activity. Non-mechanical, even you are at rest, you feel it without a trigger, without a movement. Some people even complain they feel pain when they are sleeping. And for your information, this is not common. So we move on to the next slide. Whenever we have pain, we start to wonder, what's acting up in there? I believe you have the same questions too. Well, in general, it can be any of these four. So we have our muscles in our back, and you can see there are 3 layers of muscles from the top layer, middle to the deepest layer. And it can be your joint as well, of which you see some arthritic changes in the picture here. And nerve, yes. Most of us, the first thing that comes to our mind is, oh, can it be my nerve being impinged? Well, statistically, the fact is that only about 1% only about 5% of the total cases we see is truly nerve or disc related. The rest are very much, 95% are very much musculoskeletal, as in joint and muscles related. Yeah. And can we actually tell what structures are involved from the pattern of pain we have? Let's look at the next slide. Well, I'll give you a few examples here. We commonly see people walking to us saying that, I look it up. I think it is muscles pain, referring to the big picture where you have the pain down the buttock. And I have people coming to me saying that, I look up in the Google, they said this area is actually my hip pain. It may be, it may not be. And sometimes, out of good intention, people around us that share their personal experience or what they learn from other people with us. So the other picture say, my friend said my nerve is being compressed. Well, it might be, it might not be. Again, I'd like to remind you of if you can recall what Dr. Murali talked about just now, it can be one source, multiple site of pain, or multiple source, one side of pain. It is telling you that the pain distribution does not actually reflect the structure involved. It's interesting, isn't that? The reason is because, number one, can we go back first? The reason simply because, number one, our body responds to pain differently. Number two, anatomically, we are all unique. So the body has the ability to cope with some structural pain, but it can also refer to somewhere else, which is away from the root cause. So what you see in all these pictures, it might be just a presentation of the pain referred for somewhere else, or it can be a combination of a few structures underneath, like what Dr. Murali said, multiple problem, one area of pain. All right. So let's go to the next slide. So I bet some of you, unfortunately, are familiar with this. You hear people around you saying this. The doctor or the physio or the nurse or the anyone out there that I've seen said that, oh, this will make them paralyzed. Today, I would like to bring this to your attention here that this kind of fear mongering statement is something that, as a health professional, we definitely do not encourage. Unfortunately, if you came across a statement like this, or people around you came across a statement like this, and you are in fear, you are in doubt, my advice, my suggestions to you is seek a second opinion or possibly a third opinion to get the right diagnosis to really have it investigated. Reason being, yes, in some cases we do have to be worried, but it it is only under certain circumstances that will warrant you to really to warrant you to be really worried about the conditions. Is the understanding that matter? So I'll explain to you in the next slide. Back to your question, should you be concerned? Yes, in certain circumstances, as little as 1% of the total population who come to see us. First of all, let me introduce to you this term red flag, and we'll have a look in the next slide what it is about. So red flags, in the medical term, it means alarm or warning signs that suggest a potentially serious underlying disease which warrant an immediate medical attention. Statistically, it is approximately 1% of the total cases we see. Well, this figure tells you that it is uncommon, but there is a possibility, right? And next slide. So if you're wondering when should you see a doctor, now you should seek immediate attention, medical attention if you have pain that does not improve with rest, you have night or resting pain, urinary retentions or fecal incontinence, and you have saddle anesthesia, which means the numbness around the private part of the anus, and numbness in the leg and weakness in the leg, constant fever, which is not very normal, unexplained weight loss when you are not on any dietary plan, had history of cancer with new onset of back pain without any trigger, had a recent infection, for example, lung infections. Well, all this will tell you that you should see a doctor immediately, right? And the next slide. So we'll be talking about the concept of pain management for acute low back pain here instead of going into the details. In general, back pain management, it is a multidisciplinary approach instead of thinking of it as a one pill cure it all. So the one approach cure it all, it doesn't really exist. The first step to do, for example, when you wake up with a sore back, a really bad back pain that you couldn't even stand upright from the bed when you got out of bed, the first thing is to look for any simple pain medication at home, such as paracetamol, and have the paracetamol first. Reason we start with pain management with medication is because we need the medication to calm down the system. When your musculoskeletal, your body system is calm enough for you to move, then you can start doing some simple stretches, moving about. It is really convenient for us to look up exercise online now because there are lots of video out there. The guideline again is to work within your limits. So be guided by the pain when you are in the acute stage. And after a few days, if it doesn't go away, it is time for you to seek treatment. You can speak to your physiotherapist or doctor and consult what's the best way to do it. How do we get out of this as soon as possible, wean you off from medicine and get yourself back to your normal activity? And the next thing to look at is to discuss a prevention strategy. Your therapist will be able to advise you based on the analysis, whether it's postural or you have done something in a wrong way, wrong mechanism, and correct it to prevent frequent back pain occurrence. Right? My call to you is when you have acute back pain, seek treatment earlier, avoid bed rest, still try to move as tolerable, but be guided by the pain. And the common myth is that we do encourage you to start with early pain management with medications. A short-term medications, short-term intake of pain medication, it doesn't really affect our kidney unless you have some medication allergy or it is contraindicated and advised by your doctor. Then you should always speak to your doctor and your pharmacist. Well, that's all for my sharing today. I hope you learned something out of it. And if you have anything to ask, please feel free to drop us a question. I'll be more than happy to answer that. Thank you.
Thank you, Jacinta.
Mm.
That completes all our topics for today, and I think now we can go into our panel discussion. So, can I invite all the speakers on board, please? We've actually got quite a few questions here. I hope we can cover everything. So, but not to worry, if let's say your question has not been asked, please go to the Masa University Facebook and you can ask your question there and they will direct it to us. I think, Jacinta, we might have had quite a few ladies listening in because I've got questions about being pregnant and back pain, as well as when they're having their period. So basically, they're asking if they are pregnant and they have back pain, what kind of exercises will be suitable for them?
Thank you, Mama, for the question. So to address this question, first of all, I'd like to take you back to the hormonal changes in the pregnancy. So toward the second and third trimester, the hormonal changes start to go in an upward trend due to all the physical changes we have. Now, when the changes come in, the ligaments and the muscle become lax or like what some people term it as softening. So that means that the muscle actually become weaker. A weak muscle is not able to support our spine very well. That will lead to excessive load being loaded in an imbalanced manner to certain part of your back, like particularly in a pregnancy case, that will be the lower back or toward the mid back. With regards to your questions of what can be done, so I'll put it in two sections. I perceive it as you are in a way such that you are asking for what can be done when you already have it, and the other one that I'll talk about is the preventions. So if you are an expecting mom at your second and third towards your second or third trimester, and you start to experience back pain, what can be done? The first thing is definitely to exercise to your tolerance. For example, simple exercise you can start with are some simple pelvic tilt exercises. Core and pelvic floor can still be strengthened to help to assist in giving you more support in this case, and it is definitely safe to do it despite you are heavily pregnant. And if you're not very sure, you can always go to see a physiotherapist or maybe some special therapy instructor who have been specially trained in in treating women health problem, including back pain in pregnancy. Right now, the other options you have will be exercises in the water, stretching, even walking stretches, some with some dumbbell exercise in the water that help, because in the water buoyancy lift off the excessive weight we put on during pregnancy from the tummy. It also help you to relax your muscles, right? And with regards to the preventive measure, if you are if you are newly pregnant or you're in the preparations to become a mom, my suggestion is start exercising early. The better we build our fitness foundation, we can carry the pregnancy easily in a more comfortable way. Well, I would suggest you start with some simple exercises such as Pilates, yoga, if you are not someone who is very active to begin with. Swimming is a very good option. Brisk walking as well. Some core exercises if you have no time. There are video on YouTube, so and you can follow some of the studio as well. It is now easily available online for most people to view it for free, or there will be webinar or courses for you to sign up. Right? Does that answer your questions on
Can I
the
add something?
exercises?
Can I add something? Yeah.
Mm-mm.
Usually, all pregnant mothers are supposed to attend an antenatal class.
Yep.
Okay, in that class, they are actually taught all the different exercises they are supposed to do at home and be prepared, for the day
Mm.
of delivery. Okay, so I suppose it is mandatory that they attend these classes. Okay? Because in the end, usually these classes are held at the clinics or hospital where they are going to deliver later. So at least the progress of their
Yeah.
back pain and management, okay, is recorded and followed through uh, continuously to the very day where they are delivered. So at least if at all the back pain
Mm.
persists, some
Mm.
preventive measures can be taken just prior to delivery. So and the record is there. Okay,
Mm.
so that's my advice to mothers who are
Mm.
preparing for
Yeah.
reducing how to reduce back pain and for a smooth delivery.
Mm. Mm.
Thank you.
Dr. Murali, that's a very good one to bring up. I really support people for. I really support all the uh, expecting mom to attend antenatal classes. I think this is one thing that is not very well developed in our country. When I come back, it is trending. I'll use the word trending in a lots of country around us, even just our neighboring country. If you look at it, it helps the expecting mother in preparing themselves very well. So thank you for bringing
Yeah,
this up,
it
Dr.
is.
Murali. Mm,
All major hospitals do have this antenatal class.
yes.
Um, I'm not sure about the clinic Kesihatan, the KKs, how far it has extended to it. But
Mm,
because it also depends on the nurses, availability of the nurses as well as physiotherapists in KKs.
mm, yeah.
But
Yeah,
it
I
has to
think.
be explored by all mothers, all expecting
Mm.
mothers.
We hope that this is also an opportunity for us to encourage expecting mother to be active, to attend antenatal classes.
Yeah, correct. Any other question?
It looked like Madam Maha is experiencing some connecting issue. Dr.
Hmm.
Murali, would you like to address some questions? I think there is a question directed. It looked like it is directed to you. It's a trigger point questions.
Uh-huh.
It say, is it trigger point can lead to misalignment of spine? Let me rephrase. I think she meant, can trigger point lead to spine misalignment?
Okay. Now, I don't think it will cause a cross misalignment. Why? Why so? Because actually, trigger points, okay, um, contracture of small, tiny muscles within healthy muscles. Okay, so it's very taut and tender. And if we stick in a needle into this knot, it will just relax, and you can see the muscles twitching. Unless, of course, there are major or multiple knots, probably that can cause some misalignment. But isolated one or two, no, chances are minimal. Okay, but multiple. But I've not seen so gross multiple trigger points. Okay, it's just that isolated and difficult to identify is the major issue. Even if it's there, okay, but unless chronically the patient has posted themselves in such a way that the posture is grossly misaligned, then invariably the spine will be misaligned. Okay, that is the posture problem. Okay, but trigger point itself isolated, no, but multiple maybe. Okay, maybe, but I don't think anybody has done a study on this sort of a problem. You see, okay. But it's very important that stretch exercises are conducted or done regularly surrounding that muscle, because what happens is the surrounding healthy muscle becomes weak because it's seldom used. Okay, the other side, the opposite side might be stronger, but this particular side will be weak. Even if I asked some of the patients to do just a simple push-up, that particular arm is very weak because the shoulder is not supporting. Okay, so the strengthening of that muscles is very, very important, because there is pathology within a normal muscle, but the normal muscle is neglected and it becomes a problem, painful problem for a patient, on top of being dysfunctional, weak. Okay, thank you.
Okay, thank you, speakers. Let's go on to the next question. Now, there's some viewers who are asking us about actually if they are having angina or maybe like a heart condition, what sorts of pain should they be expecting? So maybe Dr. Murali can cover that. It's a little bit out of our topic, but
No,
yes, please,
it's
sir.
not out. Okay, it's relevant. Unfortunately, it is tricky, can be confusing. Okay, even when I see patients who complain, okay, of discomfort or pain, okay, over the left side of chest, okay. Now, the one thing that again it is missed is trigger point over the chest wall. Again, okay, can be, and I have released this trigger point, and they have a good relief of that muscle spasm over the left side of the chest wall. But again, to do this procedure, we have to be very confident that we are actually identifying the muscle is the problem. But if at all, at the back of the mind, we are not unsure, it is best for patient to be referred to a cardiologist. Okay, because of course the heart is more important rather than the muscle, because the muscle is not going to kill the patient, rather the heart disease is going to kill the patient.
Well said, Dr. Murali.
Yeah.
Now, another common question that has come up a couple of times here and there is about nerve compression. So, as Jacinta said, some people may have Googled it, other people may have been diagnosed as having a nerve compression. So, possibly we'll hear from Dr. Mahin first. What are his thoughts on nerve contraction? Can it be cured? That's the question, actually.
Can you repeat the question again?
With nerve compression pain, will patients or people who have nerve compression pain, will they be able to get rid of it permanently?
Okay. So regarding the nerve compression, it is a structural change. So first of all, what we have to do is we have to take a proper investigation first, either by doing X-ray or MRI. First, we have to go with the proper investigation. So based on the investigation, only the treatment can be decided. Okay, simply we can't say for the nerve compression, give a proper solution or not. First, we have to do a proper investigation. Based on investigation, only the treatment can be decided.
Yeah.
Okay.
To add on to that, okay, if you don't
Yes,
mind.
please.
Yeah. Okay. Nerve compression. Okay. Possibilities, the causes. Okay. The disc compressing the nerve, or the disc height has collapsed, so compression on the nerve. Okay. Sometimes past spine surgery, so fibrotic structures around the nerve compressing it. So these are all the possibilities. Okay. Now, to release a nerve, okay, you've got to be very, very sure that because you see at this point of time, the nerve is considered like entrapped, isn't it? Trapped somewhere along the pathway of the intervertebral foramen, okay, or even the lumbar spine if the patient has past surgery, okay. So we need to make sure that it is whatever stretches that is advised to the patient does not damage the nerve. See, the nerve pain from the nerve can arise from two situations. One, compression to the nerve, that means triggering the nerve, or disease to the nerve itself, although there is no compression, nothing. Okay? So we don't want to cause more damage to whatever situation it is already the patient facing. If possible, we alleviate the pain and reduce the compression. Okay. Sometimes the leaking disc can cause chronic irritation to the nerve and then inflammation and pain. So at best, okay, at best in such situations, okay, we do injections to the nerve to reduce the inflammation. Okay, sometimes after a few injections, there may no inflammation, but still the patient may complain of radicular pain from a diseased nerve. Now then we sometimes proceed to radio frequency pulsation of the particular nerve to reduce the sensitivity of the nerve. Those are interventional injections that is possible. Okay, but oral analgesics are also possible. Unfortunately, these oral analgesics adjuncts, we call it as adjunct gabapentinoids, okay, work centrally in the brain. That causes a lot of side effects, being drowsy and unable to function fully. Okay, but nevertheless, it is also a choice, okay, to be considered. So when they are more comfortable with all this, then you can proceed with physiotherapy. At least, okay, because starting off with physiotherapy is not wrong, but if you're not comfortable, immediately stop. Immediately stop. Okay, get a better understanding of what's the condition of the nerve, and then follow up with it and proceed with physiotherapy. Thank you.
Thank you very much. Now, there's an interesting question here. Jacinta did talk about medication for acute pain. So, a viewer is wondering, most physiotherapists don't normally suggest medication. So, she's asking about an elaboration of this approach, medication for acute pain. So, we'll start with Jacinta first, and then Dr. Murali, you can add in as well.
Thank you for the question, Monica. I read your question. Yes. If you look at the guideline, back pain management guideline from different country and also the international consensus, the first line of management always consists of pharmacological management and a non-pharmacological management. Pharmacological management means using medications. The non-pharmacological management refer to people like us who come in to help you. So the physio, the exercise physiologist. Now you are asking why do most of the physio they don't normally suggest. I'm not too sure about that because from the consensus, this the multidisciplinary team management with both pharmaceutical approach and non-pharmaceutical approach is the practice. So maybe you can discuss this with your physiotherapist if he or she come across, if he or she talk to you about this. My guess is that some therapists they are not too sure what is or what are the allergies or other underlying medical issue you have, so they might not want to advise much on this. When it comes to pain management, I'll always say that physiotherapists cannot handle pain alone without the help of medications. I'll let Dr. Murali add in if you would like to know how do we step up from a simple painkiller to the next level.
Right. Thank you. See, yeah, I agree with you. Physiotherapists, you are not licensed to write prescription. Okay, so we have to consider the medical legal aspect of prescribing medications to anyone for that matter. Okay? But coming back to for acute back pain, okay. Now even then, in my pain clinic, I don't see acute pain back pain because basically they are all under orthopedic ward, and orthopedicians do manage. Okay, but from the prescriptions that they write for patients, okay, I find that they like to use NSAIDs, okay, NSAIDs, celecoxib, Celebrex, okay, as an anti-inflammatory as well as analgesic. It helps to reduce the inflammation if it is there or even swelling, okay, and also at times also paracetamol. In acute state, they do prescribe these. So as the condition, the back pain, acute back pain condition improves, okay, so they wean off the medication. Unfortunately, if this acute back pain does not improve with the medication, then it has to be relooked again. Okay, why patient is not improving? Because the medication is supposed to at least tackle the inflammatory side. Because that's basically how celecoxib works. Okay? Reducing inflammation. So why persistent pain? It may not be inflammatory process. It could be something else, and that has to be investigated. Okay? So medication-wise, if you go further up, okay, in the long term, as I said, adjuncts and all, but it's not for acute phase state. But sometimes to help the patient to sleep, because good sleep helps the patient to be fresh, and when they are fresh, they feel the pain lesser, much lesser. Try waking up with pain and with poor sleep. I'm sure you feel more pain in a more painful situation, okay, and being a pain to other people too, okay. So good rest and sleep is also important. Sometimes we do add the medication to sleep, but that doesn't mean you need to go around asking for sleeping medication from clinics, okay? Right? That's not the way. Okay? But as much as possible, we must take care of the back pain.
Yes.
Okay? Thank you.
Thank you, Dr. Murli. Ending on a very good note there, where all the speakers have actually touched on having a well-balanced diet as well as a well-balanced life, both psychosocially as well as physically. Okay, my, look at the time. It runs so fast when something interesting is going on. There's actually quite a few questions that we haven't covered, but viewers, not to worry. As I said, please go to the MASA Facebook as well, MASA University Facebook. You can ask the questions and they will redirect the questions back to us and we will get to you on that. Please remember, as the speakers have said, if your pain is not getting better or you feel that you need more help, please consult a doctor or a physiotherapist. There is only so much we can cover in 1 hour. It's a guideline, it's a direction for you to go towards. But if you need more help, you will need to come to one of the healthcare professionals. I would really like to thank from the bottom of my heart Ms. Jacinta Lim and Dr. Murli, because they've taken their own time out to prepare as well as spend time to come for this webinar and speak at this webinar. In addition, thank you, Dr. Mahin, as well for speaking to us. Before we end our
I hope it really benefited to the viewers. Okay? So
Yes,
that's our aim.
they will be giving us their feedback as well. So viewers, please give us your feedback, and also please tell us what else we can run webinars on. A little bit more of acknowledgement. Yes, the School of Physiotherapy webinar team would like to thank MASA University for making this platform available, the Dean of the Faculty of the Health Sciences, Associate Prof. Dr. Veronica Chua for her support, as well as Jennifer Fernandez from Marcom and Rachel Pham from MASA Events for helping us to run our very first webinar. Lastly, on behalf of the Faculty of Health Sciences, we would like to thank all our frontliners in hospitals, in the army, in the police, and other areas for standing out there for us in this war. So remember to like and share this page, and we really look forward to seeing you again in our future webinars. Thank you, speakers, again, and thank you all for joining us, and have a good rest of the day. Thank you very much.
Thank you.
Thank you.
Thank you. Thank you.